Okay, I am Dr. Shrenik Shah. I'm a consultant urologist, andrologist, transplant surgeon, laparoscopic surgeon, robotic surgeon. Today we are going to talk about the prostate cancer, which is one of the very common but silent killer in the age group generally above the 50 years of age, where gradually the prostate gland increases in size. And this prostate cancer in few patients also get developed into the cancer of the prostate. And there are no definitive sign symptoms of the cancer of the prostate. So unless the prostate is completely getting sprayed into the whole body, all over the body, then only a few people may have a symptoms like backache. Few people may have a symptoms like difficulty in walking. But these are the symptoms which are going to get developed when it is already spreaded all over the body. So, how to pick up the earlier? We can, whenever we can do the regular checkup in the form of we do the digital rectal examination, clinical examination of the patient. Then we do the sonography, uroflowmetry, and one of the blood tests, which is very important, is serum PSA. This PSA test is vital because from the normal range, when it rises, it could rise because of two things. One could be because of infection also, or could be because of cancer also. And that is the reason when we go to the urologist, when they do the examination, they figure it out. And then if PSA has rise from 4 to 10, then generally there are better ways. Apart from the ultrasound uroflowmetry, we do the that is multi-parametric MRI test, and we try to find out if there are like pyrids 3, 4, 5. We take a then biopsy, and this biopsy is generally taken by transrectal under local only, and then we send it for histopathology. And if it turns out to be the cancer of the prostate, then there are different varieties. Certain cancers which will grow slowly, certain cancers which are intermediate group, and certain cancers which can grow very fast, like listen 8, 9, 10. So these are the groups where if we identify them when the prostate is in the localized state, then that can cure. Our few of our patients who have been like 14, 16 years follow-up, they are still coming, and all those patients whom we operate, they need to get 3 monthly PSA done post-operatively. And this is one of the finest and the completely curable way. I distinctly remember one gentleman whose father we operated. And what is to be understood is this can happen hereditary. Family history is very important. Whenever any male whom we operate, we try to get all his brothers and son get his PSA done also because they have a 8 times more possibility of having a prostate cancer. So his son, we had asked him when he came first time bringing his father, he was 45. As he crossed 50, his PSA went to 5.5. Normal range is 0 to 4. So we had asked him to get the MRI, then we got his biopsy done, the pyrite was high, and then he had a similarly localized prostate. So we had removed by the robotic means. And then he asked us a question, sir, my father you're treated, myself you're treated. Now I have a two sons. So in those gentlemen, what we do is we send his blood for the genetic workup. There are about 28 to 30 genes. We screen them, and he was negative for all. So we just asked them for both of your sons, you just need to get screened at the earlier age with a regular PSA, nothing beyond that. This prostate cancer, if it is already like been spreaded to all our body, then first we give the hormonal treatment. For the initial 2 years, the prostate cancer can be taken care by hormone treatment. But ultimately it becomes resistant. So if we can bring back to the localized state and then we can knock off the prostate, surgery is one of the safe treatment today's time. Laparoscopy and robotic are the different ways that we can handle this. And open surgery is also being done in certain centers, but generally these are the minimal invasive ways so that patient within 24 hours start moving and he can be discharged in 2 days or 3 days. And this is absolutely a safe surgery. So that can be taken care. Patient has a faster recovery. And then, as I said, we look at the histopath report and then we do regular checkup by the means of doing a regular serum PSA every 3 monthly. If it has been still recur after about 3 years, 5 years, 10 years, somebody who has a like high grade cancer, or then there are different ways of the different second line of hormone treatment, chemotherapy, even if local recurrence and radiotherapy. So these are the different ways that we handle the prostate cancer. So I believe these are the basic few things which are important about the prostate cancer. So every male should be screened after the age of 50 years by the means of digital rectal examination, sonography, flow, and serum PSA. Thank you.